Okay, so you have booked your surgery, you've paid the deposit, but before you go under the knife, there are some critical steps that no one ever really talks about. Steps that really could make or break your recovery. In this episode, I'm going to be talking about the top 5 things that need to be done before surgery, from physical prep to mindset and practical home setup. You're listening to What the Gut, a functional medicine and holistic health podcast for busy women who are ready to take charge of their health without the overwhelm. I'm Allison, your host, a double board certified family nurse practitioner specializing in functional medicine, here to help you decode the gut hormone connection and finally get the answers that you've been searching for. In this space, we're cutting through the confusion and diving deep into holistic wellness, because feeling your best is not just about another diet or quick fix. It's about understanding your body, healing from the inside out, and making sustainable changes that fit into your real, busy life. From gut health to energy struggles, hormonal imbalances to sustainable weight loss, I'm bringing you practical strategies, expert insight, and real talk that will help you thrive, not just survive. So if you're ready to finally feel good in your body again, hit that subscribe button and let's do this together. Quick reminder, this podcast is for educational and empowering purposes only, and it is not intended as medical advice. Be sure to consult with your personal healthcare provider for personal recommendations. Welcome to What the Gut, where we take control of our health one episode at a time. Number 1 is the physical prep of this. This means nutrition. For about 5 years, honestly, before I decided to have surgery, I started really eating healthy and honing in on my diet. I definitely don't think that it has to be 5 years for everybody, but I would say definitely like a few months. You really want to prepare your body to be reliant and absorbing all of these nutrients appropriately. So making sure that you're eating real whole foods that are like one ingredient or come from the ground or have a mother, making sure you're getting the right supplements too, things that reduce inflammation, foods that are not inflammatory. I really encourage you to optimize your diet now and get rid of any kind of like bloating or constipation or gut issues that you have so that after surgery, you're not having to deal with that. The other thing to consider is supplements. So I did multiple different supplement protocols to really make sure that my body was prepared before surgery, but also focusing on wound healing, skin health, and immune strength. So this was things like vitamin C, zinc, magnesium glycinate, even omegas, and high quality protein. Before your actual surgery, your doctor usually will give you a list of things to avoid before surgery, certain medications and supplements. Make sure that you do follow that because there are some amazing supplements on there, but also you don't want to take those right before surgery because they can interact with certain things that they're going to be giving you, or they can cause like your blood to be too thin. Making sure that I was getting enough sleep beforehand and that my circadian rhythm was regulated was really important. And then also movement. So making sure that I was moving my body regularly. My body was used to strength training and walking. This is just going to make it so much easier for recovery for you if you already have these healthy routines in place. Number 2 is emotional and spiritual prep and calming your nervous system. So your body cannot heal in an environment where it got messed up, okay? You cannot heal in this stressed out state. So making sure that you are in the right mindset and, the whole surgical procedure is not just about aesthetics, but you're really doing this to honor your body, to improve its function and to gain confidence and letting go of any like shame or guilt that you have about needing help after surgery or even choosing surgery. I know sometimes people feel like surgery is the easy way out, but that's definitely not the case. And that's also one reason why I'm sharing all of this is because I know I had a lot of questions beforehand. I'm sure other people do too. And there's no shame at all in saying that you had surgery done. I would also say that it's really important to me that you pray about it beforehand. So I prayed a lot about this for years and really within the past few months of, is this the right time to have this done? Is this the best use of my time? Is this the best use of my money at this point in my life? And just really making sure that you're praying to ask God to guide your surgeon's hand and bring peace to your heart throughout the whole process. But I would also say, like, your support system is so important. It's really important that you talk to your partner, your close family and friends and let them know what's happening and exactly how they can help. And this can be like literal practical help or emotional help, just like supporting you. But asking for help is something that you're going to have to do. And so just making sure that you're confident in that and don't feel bad for asking for help. The third thing that I would really emphasize is practical preparation for this. So, your home and your schedule, all of that matters so much more than you think. And you really don't want to be running errands or answering emails whenever you're post op. You want to focus on recovery. So, making sure that your home is set up is the first thing that I would highly recommend. So, make sure that your bed or even like your recliner is prepared for easy access and your bathroom. Something that was really important for me is post surgery, like you do want to lay with your legs elevated and sit upright, but also because I had my abdominal muscles worked on, my legs worked on, and my breast, I really couldn't use my arms that much or my legs. It was really hard. And also not my abs. So getting up was such a challenge at first. We have a recliner, but it is one of those manual ones. I highly recommend getting an electric recliner because that way you can just have this little remote, push the button, and it's so much easier. I literally had to ask for help getting in and out of the recliner every single time for a week or so. And I'm sure that got old. But also making sure that you have a shower chair. So I was really thankful that I did get one of these a few days post op. And thank goodness for Amazon Prime. I wasn't able to submerge my whole body in a bathtub, and I also couldn't stand up straight because of the tummy tuck. So I needed to sit in the chair. You don't really think about that sometimes, but my abs were so tight and I was hunched over, which I was supposed to be. I didn't need to try to push it and stand up straight. I just needed to listen to my body, but I couldn't bathe unless I sat down. So having that shower chair was really important. I will say too, having a handheld shower head was something that we already had, but I didn't realize like how thankful I was for that until after surgery too. So that was great. I'll also say having like compression clothes, compression socks, compression garments. Usually your surgeon will send you home with a binder if you're having abdominal surgery, but you are going to need something that is giving you compression wherever you had that surgery. They make different compression garments that can cover part of your thighs, your whole thigh, your abdomen. You definitely have to wear that as much as possible to prevent any kind of like seroma buildup or fluid under the skin. I will say too, having like nightgowns or clothing that buttons up is just so much easier. Don't even worry about putting a shirt on. You're really not supposed to use your arms a lot. And so, especially if you have your breast worked on surgically. So, having like nightgowns that opened in the front and buttoned, that was just a whole lot easier. Underwear was a weird thing because of the placement of where I had like my incision. I also had drain. And so, wearing like regular underwear was uncomfortable because it would rub against my incisions. So, I usually sleep in women's like boxer shorts anyway, but these were so much more comfortable to wear just all the time because I could pull them up higher than normal. It wouldn't push on my incision. They aren't too tight on my thighs, but they also were not in my groin area, which that's where some of my incisions go to from my thigh lift. So having the right undergarment in general, that was something that was really important. Stool softeners. If you are taking pain medicine afterwards, any kind of narcotics, opioid, even just the anesthesia from surgery can definitely make you constipated. So make sure that you take stool softeners afterwards. You do not want to get constipated after surgery. And also, I had my recliner set up, and then I found this like little cart from Amazon that I would use postpartum, like with my babies, and I would put the diapers and stuff on. But this was really great for post-op because I would put like all my high protein snacks. I had like my earplugs because if my kids were watching TV or something and I didn't want to listen to it, I could just do that. I had my weighted sleep mask that I always wear at night. I had like my hairbrush and my water and everything right there. And it's got 3 layers. So that was really handy because it wasn't just like a table where things could fall off, but it had sides. So it was easy. It was nice to have that. I will also say like just the logistics of childcare and who's going to help watch the kids. I really wanted to make sure that I wasn't putting like the whole burden of having the house clean, taking care of me, all of that on my husband. So I made sure that my parents could help with the kids or they had play dates scheduled. I made sure that I meal prepped beforehand so my husband didn't have to do a ton of cooking, but also making sure you have somebody to help take care of you. So that is something that is really important too. It's just making sure that if you have a friend who's a nurse, that is your golden ticket. You definitely need somebody there to help you more than you realize if you were having all the surgery done that I did. Like I said, I needed help getting up and down like every single time, especially that first week. If I needed to walk, I actually borrowed a walker and would use that for a while around the house because I wasn't able to stand up straight. And if I was standing up for too long, my back was really hurting. So I really compare the whole recovery to a postpartum recovery. If you've ever had a C-section, it's very similar. And your back just kind of compensates for everything. And so your back really hurts. Like, even if I wanted to go in the kitchen and prepare myself some food, like, I couldn't stand there long enough to do that. So I just really needed somebody to help me with everything. Also, making sure that I was staying on top of my pain meds, taking all of that, including my normal prescription medication and also like my stool softeners, making sure that I'm doing all the things. I will say too, if you have surgery like this, blood clot afterwards is a big thing. And so you really want to avoid that. I was sent home in some blood thinners. I also wore the compression stockings, but making sure that you get up and move and walk around every few hours, your surgeon will usually tell you how often. That is something that's so important. And reminding me to do this is something that was really necessary because if I was on a bunch of pain medicines or exhausted, like I wasn't going to remember to get up. My husband set alarms for this and helps me and reminded me, but you're not going to be in the right mindset to remember how to take care of yourself appropriately afterward.
That's a wrap on today's episode of What the Gut. I'm so grateful that you're here, and I hope you're walking away with insights that bring you closer to feeling your absolute best. If you loved this episode, it would mean the world to me if you would take a moment to leave a review. It helps more people like you find this podcast and get the answers that they need. And don't forget to hit that subscribe so that you never miss a new episode. Let's keep the conversation going over on Instagram. Find me at Allison Gets Well for daily gut health tips, behind the scenes, and more ways to support your wellness journey. I would also love to hear what topics you want covered in future episodes. If you have a burning question or a guest that you'd love to hear from, shoot me an email at hello@AllisonGetsWell.com. Until next time, stay curious, nourish your body, and take care of your gut. Catch you soon.